Hi everybody, I'm Diane and I'm a physician assistant. Today we're going to talk about leaky gut, or as it's also known, intestinal permeability or hyperpermeability, meaning that the intestine leaks or comes apart a little bit, which I'll talk about more in a bit and why it's important for you. So people who have leaky gut symptoms can notice several different things happening for them, including frequent cravings for sugar or carbs, weight gain that you just can't seem to shake off because you're actually taking in a little extra water into all your cells, and so you are kind of retaining some weight that you're having a little trouble losing. Frequent abdominal pain, bloating, gas, diarrhea, constipation, fatigue, especially fatigue that you just can't seem to shake even if you feel like you get enough sleep. Headaches, brain fog, memory loss, mood disorders, things like depression, sometimes anxiety, but more on the depression end usually with this. ADD, sometimes ADHD. I saw it said somewhere that sometimes schizophrenia can be influenced by this too in one of the studies I was looking at. Also, skin conditions are very common: rashes, eczema, acne, psoriasis, rosacea, joint pain and aches from the inflammation. Sometimes there's even swelling that you can see in the joints. Autoimmune disorders like rheumatoid arthritis, lupus, celiac disease, Crohn's disease, ulcerative colitis. Occasionally, hypertension or high blood pressure can even be linked to leaky gut symptoms or syndrome, and as you clear that up, the blood pressure can return to normal. Muscle aches and pains, thyroid problems, nutrient malabsorption, and especially, this is the one I feel like I saw a lot, food sensitivities or food allergies that don't make you need an EpiPen. You don't necessarily have swelling in your tongue, your lips, your airway area, but food allergies where you break out in hives, you don't tolerate certain foods well, that can go along with a malar rash or a butterfly rash that spreads across the bridge of your nose and your cheeks, or shiners underneath your eyes. That's look like bags sometimes, but it's that purpley blue underneath your eyes. I've seen it in little kids with food allergies. Sometimes you'll even see a little crease right here on the bridge of their nose from frequently running nose from food allergies, and little kids going to wipe their nose because that's kind of what little kids do. And another symptom that you can see too is when you stick your tongue out in the mirror. If you notice swelling on the edges of your tongue from the imprint of your teeth, that's often related to food sensitivities. All right, so here's what happens when you have leaky gut or intestinal hyperpermeability. I brought my fancy Netter book, which is the Atlas of Human Anatomy. Didn't have all the pictures I wanted, but some of the ones I do. So your intestinal system starts in your mouth, you chew, you swallow, it goes down your esophagus, into your stomach, where things get broken down even further, and then your absorption of what you've eaten actually starts in, let me get you a better picture, in your small intestine, which we have a picture of here. So small intestine, then you're absorbing the nutrients, then food passes into the colon and then goes out. The colon takes out the extra water, and then you release what you didn't need in the waste products. So in that small intestine, there are millions and millions of villi, little finger-like projections to help you absorb your nutrients. On each villi, there are millions and millions and millions of microvilli, little bitty fingers on the fingers to give you surface area to be able to absorb. If you were to spread all of the surface area of your small intestine out, it would cover a tennis court. You have so much surface area to be able to absorb, hopefully, the nutrients in your food. So those microvilli have tight junctions. They're nice and close and smushed up next to each other, and they have just enough space to pass little bitty particles through them. That area, that space is called the tight junction. It's supposed to be 1 cell thick, so you just pass the nutrients you need into it. With leaky gut, instead of nice and tight and just the right molecules passing through, the spaces are a little bigger. They're more permeable, or more stuff passes through than should. When that happens, you're getting larger pieces of things into your system, and your immune system says, whoa, this is not what we're supposed to see from food. So it clumps around that, pulls it out of circulation, and deposits those complexes in different places. Sometimes like your joints, so you get arthritis. Sometimes in your stomach, so you get a little more weight gain. It can lead to these different conditions that happen and make you really uncomfortable. So, in addition to that, you're not absorbing the nutrients you're eating correctly. So it can lead to hormone imbalances because you don't have the right things to feed your hormones or build your hormones. It can decrease the ability your immune system has to work on other things. So you can get sick more often. You can make it harder for you to recover from things because your immune system's already busy and tied up working on these things. So it can be a possible trigger for multiple different disease states. This can also be a two-way street. Sometimes if you develop these diseases, you can end up with leaky gut. So the research isn't always 100% clear on what comes first. Sometimes it's a chicken versus an egg thing. But a lot of times, if you work on your gut, you will have improvement in these other disease states. So this is not always something we talk a lot about in conventional medicine. So if you've gone that conventional medicine route, seen an endocrinologist, seen a rheumatologist, and you're feeling okay but not great, I would recommend you work on your gut. You may find that you're getting back the health you want and you feel better and you finally lose those 10 or 20 or whatever pounds that you might have gained and want to just go away. So you want to be able to eat things and not break out all the time. That was part of my story. So possible diseases that leaky gut could trigger. So food sensitivities, like we mentioned, chronic fatigue, fibromyalgia, multiple sclerosis, migraines, thyroid dysfunction, adrenal fatigue. Oh, friends, I got videos on those. Mood swings and disorders, hormone imbalances, skin conditions, autism, ADD, ADHD. Yeah, this is the symptom list we talked about. Possibly it may influence type 1 diabetes. Type 1 diabetes, you develop antibodies that attack your own pancreas that makes insulin, and it is suggested that some of the markers for leaky gut are very, very elevated in people who develop type 1 diabetes. So, celiac disease, irritable bowel, and inflammatory bowel syndrome. Inflammatory bowels, Crohn's disease, and ulcerative colitis. Some endocrine disorders like polycystic ovarian syndrome and type 2 diabetes, and chronic infections. So possible causes of leaky gut, what might have started it? So things that can disrupt your hormones pretty significantly. For us women, we're talking pregnancy, birth control pill use greater than 2 years, menopause, antibiotic use, particularly multiple antibiotic use, frequent antibiotic use in a short period of time. Steroid use, we're not talking necessarily going to the gym, illegal steroids, we're talking prednisone usage for bringing down inflammation for different things, which unfortunately is a treatment used for a lot of the inflammatory and autoimmune disorders we've talked about. Exposure to heavy metals and toxins, chronic illness, things like adrenal fatigue, undertreated thyroid symptoms, ongoing things will wear down your gut to the point that it leaks. Long-term stress is included in that. Long-term stress and adrenal fatigue can sometimes go hand in hand. But if you've gone through a challenging divorce, a big move, even if you wanted to make it, that can count as a big life stressor. Health problems for someone else in your family, a child, a spouse, a lot of those things will wear on your body, and your gut takes it into account. So this is time to get you better and get you healthy. Long-term non-steroidal anti-inflammatory use. That's Advil, Aleve. Advil is also Motrin or ibuprofen. Using those frequently, like every day for a few months, can do this to you. High sugar intake. Alcohol, particularly frequent and large amounts of alcohol use. Eating disorders, especially anorexia, cancer and many cancer treatments, genetically modified foods, nutritional deficiencies, inflammation, intestinal dysbiosis. That's overgrowth of the wrong bacteria. Yeast, parasites, bacteria. All those count as intestinal dysbiosis, overgrowth of the wrong stuff in your gut. All right, so in this moment, I just need to talk to you a little bit about zonulin. It is a protein that regulates that intestinal permeability. It regulates, tells your body, be this close or be this far apart. So both bacteria and gluten can trigger the release of zonulin. And in people who are genetically susceptible to leaky gut, they will respond to this zonulin increase with leaky gut. So just want to make sure we took a moment to talk about zonulin. So how do you test? What can you look at objectively to know if you have leaky gut or not? There's several different things that we tend to use. Some of these tests are a little older, some of them are a little newer, depending on which holistic healthcare provider you see. They may have a preference to which test they prefer to use. So very, very common are stool sample tests. A whole lot we can find out from your poop. It's good, trust me. It's weird, but it's worth doing. So in the stool sample, we often test for overgrowth of bacteria. If you have bad bacteria in there, it'll show up in your stool sample, and that leads to leaky gut. So usually zonulin is also a stool sample test. So you usually check for parasites, bacteria, and yeast. You're looking for, do you have the good ones? Do you have too much of the bad ones? Sometimes you can handle a low level of bad ones. So a lot of people talk about SIBO right now, SIBO, small intestine bacterial overgrowth. This is the test that would let you know if that's going on. So also there's blood tests that we like to do. For the blood test, you're usually doing an IgG food sensitivity test. I'll link in the bottom to my food sensitivity post that go into a lot more detail what's an IgG food allergy or sensitivity versus IgE. IgG delayed reaction can show up 3 to 7 days after you've eaten the food, usually really not life-threatening. IgE, life-threatening food sensitivity, has got to carry an EpiPen. Usually we do skin testing for that type. You can do blood testing, but we almost always do skin testing in adults. Sometimes for a baby, you'll do blood. So we also sometimes do vitamin and mineral deficiency testing. You're not absorbing stuff properly, so you can find the deficiencies. I like hair testing a lot for mineral deficiencies. Sometimes people do blood testing. It just depends. I like the hair analysis because you can kind of see this longer term pattern. You can also look for LPS antibodies in the blood. LPS is lipopolysaccharide. It's a part of the outer membrane of certain bacteria that live in your gut. If that membrane is passing through into your bloodstream, your immune system will mount this inflammatory response to it. And you can find the antibodies to that in your bloodstream if you have leaky gut. You should not normally be experiencing this gram-negative bacteria getting through to your bloodstream. So it can also show the severity of leaky gut with how many antibodies you have. Another one is actomycin antibodies. Actomycin is what holds those tight junctions together. It's one of the proteins right at the edge of the little cells. So when they're compromised, when things are starting to pull apart, when zonulin says get further apart, that actomycin will be exposed. As it breaks down, your body will actually form antibodies to that. So you can check those antibodies. If you have leaky gut, you will have some antibodies to that actomycin membrane. And that's a blood test as well. And then there's a urine test. This one is an older test. I don't see as many practitioners using it, but it still has some data that might be valuable. It's the Lactulose Mannitol test. Some people use something besides Mannitol, but that's the more common one seen. Lactulose is a really big particle. Mannitol is really small. So you're given a compound with these sugars in it. They're both a type of sugar. And you drink it, and then you collect your urine, usually over 24 hours, and see how you've done. If you are able to absorb the lactulose and pee it out, you will you have leaky gut, because it means you're letting these really, really big particles through your digestive lining, going through your system, and then you're peeing it out. So if you have low levels, you don't have leaky gut. If you have high levels, you have leaky gut. Mannitol is a really small particle. It's usually very easily absorbed. If they're not seeing mannitol in your urine, you're not absorbing well. You're not picking things up, you're not picking the right things up and getting it into your body like you need to. The problem with this urine test is that there's a lot of variation, depends on the amount of sugars they actually put in your drink that you drink, times of collection, how often you pee, all things like that. So it's probably why we don't use that one as often anymore. All right, real quick overview on how to treat leaky gut, and I will drop you some links for a lot of other things that can help you with leaky gut. But this is just our big overview. So this is based on the 4R program that was developed by Dr. Jeffrey Bland. I like it because it's a little easier to remember, so that's why we're going to focus on this. Number 1, remove the stressors. So take out what is overloading your gut. If that's food sensitivities, if you're eating constantly all these foods that you are sensitive to, you're not going to heal your leaky gut. Take them out. Take them out for different periods of time. Lots of different ways to do this. If you have an overgrowth of bad bacteria, parasites, yeast, you need to get that treated. There are lots of great natural ways to do that. Occasionally I've had to use antibiotics in patients for certain ones, just to heal it up quicker. So that's very, very important. Toxins, environmental toxins, genetically modified food, taking those things out can help. Non-steroidal anti-inflammatories, all that Advil and Aleve, stop using it. Alcohol, large amounts of alcohol, and refined carbohydrates, because they convert into sugar into your body, and particularly they'll feed yeast. So once you've taken the bad stuff out, replace. Well, he says replace for number 2 and reseed or reinoculate for number 3. I kind of combine them both. Once you take the bad stuff out, you need to put the good stuff back in and get it populating. So that's probiotics, prebiotics, planting the good stuff in your gut that should be there to help you digest your food properly. For some people, this also can mean digestive enzymes to help you break your food down better, kind of at the stomach part of it. And also, sometimes for some people, that's some things to help your stomach acid be a little better. We have taken things like Prilosec, which is a proton pump inhibitor, shuts down your acid production in your stomach. We've taken these for so long that some people don't actually have a lot of stomach acid. So definitely talk to your integrative medicine provider about that if that's a problem for you, because there are a lot of other things that go on with particularly acid reflux coming up into the esophagus that can lead to cancer. So you need to talk to your provider about that. But I'm just planting a seed. Maybe that's something you need to know about. And finally, repair. Good nutrition, knowing what to eat, when to eat it, and supplements. For a lot of people, course of supplements is important. I know I mentioned probiotics before. Typically that means rotating through probiotics to plant different strains. You do not need to be on probiotics in pill form forever. It's a limited time thing to plant the good bacteria after the bad bacteria has been removed, or while you're in the process of it, and reseeding different strains of probiotics. You have the good healthy variety in there. So anyways, I hope that helps give you kind of that big overview of what's going on and what is leaky gut. So you can do this, friend. You can be so healthy. You got this.